Now this is a cut section of the axilla. In this cut section, we can see the anterior wall, we can see the posterior wall, and we can see the medial, we can see the lateral aspect. Anterior is made by the pectoralis major, pectoralis minor. Posterior in line, it is made by the latissimus dorsi, teres major, and the subscapularis. We can see latissimus dorsi, teres major, and the subscapularis muscle. Do you appreciate? This is about the anterior and the posterior wall. Fine. What about the medial wall? Medial wall is made by the ribs. So upper 4-5 ribs, they make the medial wall, which is covered by the serratus anterior. What about the lateral wall? Lateral wall is made by the humerus. Lateral wall is made by the humerus, particularly which part of the humerus? Particularly that part of the humerus which makes the intertubercular sulcus. So in this region we have intertubercular sulcus. Why it is called as intertubercular sulcus? Because on the humerus we have greater tubercle and we have lesser tubercle. In between the two tubercles we have intertubercular sulcus. Okay, so this region is called as intertubercular sulcus region of the humerus. So these are the boundaries of axilla. Let us write down the notes. Let us write down the notes that what are the other boundaries here. We have drawn the diagram. We have learned about the axilla. We have also learned about the axillary artery division. Let us write down the anterior wall. Anterior wall is made by pectoralis major, pectoralis major muscle, pectoralis minor muscle, and subclavius muscle. Posterior wall is made by you see latissimus dorsi and teres major and subscapularis. Medial wall is made by upper 4-5 ribs, which is overlapped by serratus anterior, and the lateral wall is formed by intertubercular sulcus region, or which is called as bicipital groove, which is also called as bicipital groove. Bicipital groove. Okay, so we have intertubercular sulcus region, which is also called as bicipital groove of humerus. These are the boundaries of the axilla. So what we have learned about the schematic diagram of the axilla. We have learned about the apex of the axilla. We have learned about all the walls of the axilla. Now, before I write the contents, please tell, have you understood the walls of the axilla, the anterior wall, the posterior wall, the medial and the lateral wall, right? Have you understood this? Yes or no? You have to tell me if you have understood the axilla boundaries. If it is done, I can write the content of the axilla. Contents of the axilla are axillary artery and its branches, axillary vein axillary vein and its tributaries. Axillary vein and its tributaries. Serratus anterior, anterior beta. Serratus anterior. Axillary vein and its tributaries. Cords of brachial plexus. Cords of brachial plexus. Cords of brachial plexus. Axillary fat. And axillary lymph node. I mean, it is fine. Axillary fat. Okay, these are the major things. You can write axillary lymph nodes also, which are also again very important part for, you see, the lymphatic drainage of the breast, and clinically also it is very important, the axillary part. Yes, beta, ये subclavius and pectoralis minor, they lie deep to the pectoralis major in the anterior aspect, so those are also considered in the anterior wall, but that is not very significant muscle. Subclavius is very insignificant muscle. That is the answer, Nishtha. And Tanishq, the muscle which divides the axillary artery into three parts is the pectoralis minor. How does it divide? The part proximal, the part behind, and part distal. This is how the axillary artery is divided into three parts, right? So now that we have written the names of the axillary, the contents of the axilla, that is axillary artery, axillary vein, cords of brachial plexus, axillary fat, and axillary lymph node. Among these contents, two contents, they are of special reference. Those are needed to be known in detail, that is axillary artery and the brachial plexus. Okay. Otherwise, axillary vein, it simply follows the axillary artery. You see, simply veins, they follow their counterpart arteries. And the axillary lymph node is particularly important for the breast lymphatic drainage, which is again very important topic in surgery. When you reach final year, you will be actually discussing this part in detail, and in anyway in basic anatomy in first year also this is required to know, because again breast is very important topic, and then lymphatic drainage of breast is very important. Why? Because of the increase in incidence of the breast carcinoma, okay, breast cancer. So that is why the axillary lymph node is also very important. But in the axilla, that part we will discuss with the breast only. Now with the axilla, that we are going to discuss is the axillary artery and the brachial plexus. Okay, let us now talk about the axillary artery. So axillary artery, what are the points for the axillary artery? Let us write down the points for the axillary artery. Points for the axillary artery are, write down, it is a continuation of, subclavian artery. It is a continuation of subclavian artery beyond first rib. Beyond first rib. Because we have seen as soon as it crosses the first rib, it enters the axilla. and as it enters into axilla, it is called as axillary artery. Second point, the same artery will continue as brachial artery. It will continue as brachial artery. So this is a continuation of subclavian artery. It will continue as brachial artery. Beyond which muscle? Beyond teres major muscle. Beyond teres major muscle. Beta Abhishek, subscapularis is present anterior to the scapula, okay, and not anterior to the axilla. If you look in your body, your armpit is the axilla, okay. So the subscapularis actually is present behind. Scapula is present behind, no. The subscapularis muscle स्कैपुला के तो इंटीरियर में होती है, लेकिन अगर आप आपके आर्मबिट को देखो, उसके रिस्पेक्ट में क्लेविकल सामने आ रहा है आपके इंटीरियर की तरफ, इंटीरियर फोल्ड बनाएगा एक्सिला का, पोस्टीरियर फोल्ड आपका स्कैपुला के साइड में बनेगा ना, तो वहां से जो मसल आ रही है दैट इज सबस्कैपुलरिस. ऑलराइट, एंड ऑल्सो यू नीड टू रीड इन योर बुक्स एज वेल, ओके. This how and why, they are endless, okay. They can be asked after each and every sentence, how and why, and all the hows and whys cannot be answered. But let me tell you, for your how, answer is it is anterior to scapula, not anterior to the axilla, okay. For the axilla it makes the posterior wall. Now let us proceed and understand. Axillary artery is a continuation of the subclavian artery beyond first rib. It will continue as a brachial artery beyond teres major, and it is divided into three parts. It is divided into three parts by pectoralis minor muscle. By pectoralis minor muscle. These are three important points about the axillary artery. Okay, clear? Continuation of the subclavian artery, continue as brachial artery and divides into three parts. All these three are very important points. You need to remember these. All these 3 points are very important point. You need to remember this, okay. Now let me tell you, in the very initial part, I hope every one of you are listening, okay. Many of you are not responding, that is absolutely fine. You have the choice whether to respond or not to respond, that is fine. But let me clarify in the very initial part of the beginning of the systemic anatomy that the notes that we are going to write in the classes are basically the high yield stuff, okay. So you will see these notes, they are not exactly what is written in the BDC or what is written in the Vishram Singh or maybe other books, because this is not from a single book, it is from I mean different books, okay. Some part is from you see Gray's and some other. So ultimately you are getting a high yield stuff, but as such what you are going to write in your university exam, it will depend on your college pattern. All of you, are you understanding that you need to understand this point very, very carefully? What I am teaching is anatomy, but again, this is your knowledge of anatomy, this is your concepts of anatomy that will be cleared. And of course, for the PG entrance exam, I can definitely tell you that these points that I am going to tell you are going to help you. But for the university exam, it is entirely your college based. So what we are teaching will help in the concept building, okay. And how to write is according to your teachers, how they are teaching in the class. If they are following, all your batchmates, everyone is following BDC, then go according to that. If everyone is following Vishram Singh, go according to that. So you must be clear about this part. But yes, I can guarantee one part, your concepts will be clear. That is the whole idea of these classes, that your foundation of concept building will be very, very strong. Okay, that we can tell. Now, after understanding these three parts about the axillary artery, let us talk about the branches of the axillary artery. Let us talk about the branches of the axillary artery. So, branches can be remembered this way, that we have, what are the parts of the axillary artery? Parts are first part, second part, and third part. Three parts of the axillary artery. First part gives only one branch. Second part gives two branches. Third part gives three branches. So altogether 6 branches are there. First part gives one branch, second part gives two branches, third part gives three branches. Alright. Now how to remember the names of the branches? For these branches of the arteries and other parts in, you see, many at many places in the medical, all the medical subjects, you are going to use mnemonics, okay? And mnemonics are those which help us remembering the things. Mnemonics are those which help us remembering the things, okay? So here we are going to use this mnemonic, which is salt, salt, spa, salt, spa. Now, how to use this mnemonic, let me tell you. First, let us draw these lines here. And this T means thoracic. T means thoracic. And this T is a common for S, A and L, because it belongs to the word salt. So it is common for S, A and L. How we are going to use? S means superior. S means superior. Add T. What is T? Thoracic. So the name of the artery is superior thoracic. Do you understand? What is A? A means acromio. Acromio. Add T. What is T? Thoracic. L means lateral. Add T. That is thoracic. So we can say this is the mnemonic which will help us remembering the branches. How to remember the branches? First part gives one branch. What is the name of the branch? Superior thoracic. Second part gives two branches. What are the name of the branches? Acromiothoracic, lateral thoracic. Third part gives spa branches. Spa. What is the meaning of the spa? Let us write down. S is nothing but subscapular. S is nothing but subscapular. And if it is subscapular, it should travel in front of the scapula or behind the scapula. It should travel in front of the scapula, because in front is below. In humans, it is in front. Okay. So subscapular artery is a branch from the third part of the axillary artery. After we have learned about the axillary artery, third part here, the remaining branches are, they are starting from P and A. What is that? Pacha and Acha. What is Pacha Acha? What is Pacha and Acha? Let me write the full form of Pacha and Acha. This is posterior circumflex. This is posterior circumflex humeral artery. Okay, posterior circumflex humeral artery. Posterior circumflex humeral artery. And what is Acha? Is anterior circumflex humeral artery. Now let us have a very quick revision of the salt spa. So we have this mnemonic salt spa, and T is thoracic. How to use this mnemonic? T is thoracic. We will use the T with S, A and L because it belongs to the same word. S is superior, add T, superior thoracic. A is acromio, add T, acromio thoracic. L is lateral, add T, lateral thoracic. So superior thoracic is the only artery from the first part. Acromiothoracic and the lateral thoracic are the two branches from the second part. Then SPA. SPA means S for subscapular artery. Then Pacha and Acha. Pacha and Acha is nothing but posterior circumflex humeral artery. and the anterior circumflex humeral artery. Is that fine? Yes. Have you understood? All right. Now you see this is acromiothoracic artery. Acromiothoracic artery is further divided into some branches. The acromiothoracic artery is divided in, it gives further branches. Acromiothoracic gives A, B, C, D branches. What are the branches from the acromiothoracic? It gives A, B, C, D branches. What are the A, B, C, D branches? A is acromial branch. A is acromial branch. B is breast or pectoral branch. Breast or pectoral branch. C is clavicular. D is deltoid. Okay, acromial branch, breast or the pectoral branch, clavicular branch, and the deltoid branch. Okay, so these are the branches of acromiothoracic artery. Okay, these are the branches of acromiothoracic artery. So this is all about the axillary artery that we need to remember. What I have told, that axillary artery is a continuation of subclavian artery beyond first rib. It will continue as brachial artery beyond teres major. It is divided into three parts by the pectoralis minor muscle. Then we have discussed about the branches from three parts. First part will give one branch, second part will give two branches, third part will give three branches. Mnemonic is SOLT SPA. Superior thoracic from the first part, acromiothoracic and the lateral thoracic from the second part, subscapular pacha acha from the third part. What is pacha acha? Posterior and anterior circumflex humeral artery. Then we discussed about the acromiothoracic artery gives four branches. A, B, C, D is the mnemonic here. Acromial branch, breast or the pectoral branch, clavicular branch, and the deltoid branch. Yes. Now tell me quickly, guys, are you guys understanding this? कुछ समझ आ रहा है आप लोगों को? और कुछ टॉपिक पढ़ने में आसानी हुई है? जिनका पहले अपर लिम्ब हो चुका है, जिनका भी हुआ ही नहीं है, they are not aware what are these terms, that I totally understand. But those students who have already covered the upper limb, are you guys understanding this? And do you guys really feel that I mean, it is becoming a little bit easier now? Tell me honestly whether you feel that now the things are a little bit easier using all the mnemonics and orientation. Yes or no? If it is helping you or not helping you, tell me. Your understanding of these things and grabbing the things, right? And tell me now, you are enjoying? Are you guys enjoying, or anatomy feels like a burden? This anatomy, are you enjoying or it feels like a burden? All right, very good. Now you should enjoy. All right, you should enjoy, है ना? क्योंकि somehow you have to do, somehow you have to study. If you start enjoying your studies, it will definitely help you. If you think it is a burden, then it will haunt you. Anyway, you have to finish it. You don't have a choice. Okay? You have to finish it. So you don't have a choice, so it's better that we start enjoying it. All right?